ever wondered how psychological factors could influence your dietary intake during cancer treatment? Understanding this connection is more crucial than you might think. In this segment, we'll dive into the complex interplay between mental health and nutrition on this Patient Empowerment Network Restore program. So, Joelys, what psychological factors most commonly affect a cancer patient's ability to maintain proper nutrition during treatment?
There are many psychological factors here in hand, but some most important ones will be like anxiety, depression, and stress are the most common ones in cancer patients and can significantly affect their ability to maintain the proper nutrition during and after treatment. For example, anxiety can lead to reduce their appetite or cause a patient to skip a meal altogether because they're super anxious about their treatment, and sometimes they can actually forget to get their a meal the meal of the day. Depression might also make it difficult for patients to find motivation into prepping a meal themselves, or even buying a meal. Sometimes they could specifically if they live alone, sometimes it's hard to just think yourself, what can I eat? What should I eat? And that can, that can cause stress. That's where the stress comes, whether from the diagnosis itself, or it could be financial concern or worries about a family member. That can lead to a patient to have erratic eating patterns. And sometimes they might overeat as a coping mechanism, but while there's others that might lose their appetite completely and not even recognize that they have lost their appetite or they had a meal of the day. Additionally, this can also cause cognitive changes like chemo brain. We have all heard about chemo brain. We forget, or foggy brain. This can also affect the meal planning or prepping. This can make it very challenging, as many patients can lead to unhealthy eating habits. It's also worth noting that taste can also change during treatment, which can also be a really huge side effect that many patients go through. As we can know previously, maybe a patient enjoyed certain foods. Now they might not be able to taste that food, and they might find it unappealing, and making the patient's ability to eat well super complicated. And I feel like to help address these issues, I have been working with patients closely to identify these psychological barriers and creating some coping skills or some coping strategies that can make it easier for them to eat, or to make some meals some easy to prep meals more enjoyable, such as small meal prepping, like just involving your family or friends overall to make something that you used to like, or that you used to enjoy. That can help also a patient kind of overcome that barrier by having also the emotional support that many can gain from counseling or support groups, or their family members or their neighbors. It could be anyone. Also, like, for example, a puppy. You can have a puppy providing you emotional support. I am a huge fan of puppies. And just recognizing and addressing these psychological factors is very crucial in helping a patient maintain their nutrition and overall health during and after treatment, and not just patients, but also the care partners. Care partners also go through those challenges, especially wanting to make sure that the patient is eating well, or that the patient is getting the correct nutrition.
Okay, thank you so much. So for both you, Nicole, and Joelys, we'll start with Nicole first. What strategies can be employed to help cancer patients overcome psychological barriers to healthy eating, such as anxiety, depression, or changes in taste and appetite?
So piggybacking off of what Joelys just offered, I think that really utilizing your healthcare team and all the resources available is going to be critical. So we want to make sure, there's nutritional counseling available. A lot of times getting enough protein is difficult because, I mean, if you're not eating a whole bunch of chicken all day, I mean, it's hard to get enough protein all 3 meals. So, things like Ensure or Boost or whatever it is that your healthcare team recommends, not only can they recommend it, but usually there are social workers that can help you get, either coupons or discount codes or whatever, because the cost can also add up. So that's a huge strategy, right? Utilizing your network, your healthcare team, to really make sure that you're, helping alleviate any of those issues that you may be having is first and foremost. Next, I would say, if you needed it, there are cognitive behavioral therapy techniques as well as like behavior change techniques that you can use and you can go through with a counselor to figure out how you can change your thought process and help set goals, monitor, food journals, all these little things that for some people super helpful, other people maybe not so much. Other people, it might just be like, hey, I just need to remember to eat something today. I need to be able to keep my food down in order to take my medicine. So that's where we're going to prioritize our efforts, right? And then also, as far as the taste and texture thing, okay, there are texture things that some people either can no longer handle or, have never been able to handle really. And so we want to make sure that we are encouraging or offering suggestions that are helpful, but also, there are things that happen with side effects when it comes to your mouth, your salivary glands, your taste buds, all of that, your throat. There are side effects that so many different patients with cancer experience that are not really talked about. And so we have to make sure that we are just on top of it. So we're making sure that if you're not eating something, if you don't go near a certain food, what's the reason there? And then we can, offer suggestions if we need to. Another thing that is difficult to do is mindful eating. And what does that mean, right? Promoting like slow eating. So there's chemicals in your brain that whenever you are eating too fast, your body doesn't understand, like it takes a while to catch up and say, oh wait, I'm full, or oh, you know what, this is not what I needed right now. So we want patients to just slow down, make sure you are listening to your hunger cue. Like, if you don't really think about it, sometimes you're like, oh my goodness, it's gone 8 hours and I haven't had anything but an apple. That's not going to be helpful long term. So we want to make sure we're having patients understand the consumption process, what it looks like, how often should I be eating, and what are the meals, what should they look like? Are berries enough, or do we need to add like a protein, some walnuts in there to eat the berries with the walnuts? What is it that I need to do in order to make sure that I am meeting these nutritional recommendations? So making sure that we're checking in with our patients and making sure that we are asking those questions and just, touching base and providing that encouragement and letting them know that, you're doing a great job and we're here for you. And I can help if you want, but I also don't want to overstep, finding that fine line with your patients is hard, but it's, the relationship is critical.
Okay, thank you. And Joelys, do you have anything to add to that? Different strategies that can be employed by cancer patients to help overcome those barriers to eating healthy?
Honestly, I want to piggyback on what Nicole said. She mentioned most of the strategies that I can possibly think of at the moment, but making sure you work closely with your healthcare team, it's very important. That could be either the dietitian or your mental health professional, making sure that you are having a unique personal plan for you. That's very important, just not just for the nutritional part, nutritional needs of a patient, but also for the psychological needs. For example, like I mentioned before, anxiety and depression. If you're feeling anxiety and depression, psychological support, might like counseling or therapy can be super beneficial because they can help you manage those emotions and find motivation in eating again. Also, for example, you mentioned the taste of the changes of taste. You can also continue to try small spices or different spices or different texture until you're able to get to that comfortable space that you're looking for, and not just trying to give up at the first hand. I know it could be tough. It is tough to be, focusing on whether your mental health or your nutrition, but also being able to, focus on having to celebrate that little small step. It's very important to continue motivating yourself. And also, I encourage having small meals. Don't think about it as a full meal perspective when you're looking at your nutrition. Because starting small is better than starting big and being disappointed and having that disappointment or overwhelming feeling.
You heard it here directly from our experts. Thanks for joining this Restore program. I'm your host, Lisa Hatfield.